Hey everyone, I'm Dr. Richard.
And I'm Dr. Blanchette.
And welcome to the Stepsisters channel, where we plan to talk about foot and ankle conditions.
Yes, this is our first episode of many, and we're very excited.
Woohoo! Okay, since it's our first episode, we wanted to introduce ourselves. And we're both board-certified podiatrists.
And foot and ankle surgeons. And we both work in the United States. And we are both French Canadian.
Hence the accent. Sorry.
Oh, and then we're friends.
Yes! That's the most important part. Yeah. We're friends.
We're friends.
Yeah, we're not really stepsisters.
We're not really sisters. But wait till you hear the story. It's very funny. So we're both French Canadian podiatrists, and we're both married to podiatrists, Gujarati, who has the same last name.
Exact.
Like, what are the odds?
What are the odds?
It's crazy.
Yeah, and we both practice in the US, 30 minutes from each other.
Crazy.
Yeah, well, that's why we decided to start the channel.
Yes.
To educate, entertain,
yeah, because
give you a little bit of our flavors.
Exactly. You know, we're both passionate about podiatry. We love what we do.
As you can tell.
We love helping people. We can help people one at a time.
Yeah.
In the office, you know, I have a patient, I'm helping them, but I can't help 10 people at the same time. But with this platform, with YouTube, social media, we can actually educate people and then tell them, you know, about their feet and their ankles and conditions and entertain also at the same time. And then just to help and then make you feel better.
Exactly, yeah. That's the goal, that's the mission.
Yeah. So stay for the ride. Our Canadian diploma doesn't allow us to practice in the United States because you cannot do residency just with a Canadian diploma. So we have to come back here, redo the last year or two last year.
Yep. Depending on the year you decide to come. Yeah.
Exactly, because the things change. It's not because I needed, you know, one, she needed two. It's just because everything changed.
Yeah, let's not talk about that.
Because she's really smart. And like, I can't believe you did 2 years of school before doing residency. It's crazy. Why did you get into podiatry, actually? I don't even know.
You don't know? Well, actually, because I was training for a half marathon.
Okay.
And I got Achilles tendonitis. And my mom was like, go see a podiatrist. And I did not know the profession at that time. And he cured me. I was able to run.
And you were like, change my life. Let's go.
You got it.
So that's very interesting.
Yeah. What about you?
I actually, I didn't know what I wanted to do. And then I was in a very small town in Quebec called Matane. And then we had no podiatrist. I was actually on my feet all the time. My feet were hurting me. I was working at a pharmacy, and then I would see people coming and buying like little padding for hammer toes and things like that. So I knew there was a need for it. But so I didn't know what I wanted to do. So like my mom was like, you know, just like send, you know, application and then you'll see. Because one of my friends had told me, she's like, tonight I'm sending my application for university. And then I was like, oh my God, I'm going to lose a year, you know, if I don't apply to anything.
Chop, chop.
Exactly. So then that day, instead of doing my homework, I just look at like this big pile of like all the different like colleges and stuff like that in Canada, universities. And then the only thing that stood out was podiatry. And I was like, oh, what is this? And then I'm like, oh, my feet are hurting. There's no podiatrist here. And then you could do surgery. And there was an externship in New York City. So for me, like from this teeny tiny like small town, I was just like, yes, let's do it. And then the rest is history.
Let's talk about how to become a podiatrist. So first of all, you need to go to 4 years of medical school, podiatry school, and then you go through 3 years of residency training where you learn about surgery. Yeah.
That's where you become a surgeon. Usually the first year, you're going to be, you know, you're an intern and then you're learning things like on the floor, like, you know, infection, diabetes and things like that. And after that, the more you go into like reconstructive surgery and more like, you know, very big and interesting cases.
You also do rotation with other specialties. So you can do vascular or general surgery.
Orthopedics.
You go through the ER, infectious disease, internal medicine. So you kind of get the full spectrum.
Through all of that. And after residency, you can decide to start working, either start your practice or go into fellowship. There's some in reconstructive surgery, there's some in wound care,
trauma,
some in peds, trauma, what have you. So the sky's the limit, really, with podiatry.
So after you're done with the residency program or your fellowship, you're gonna either work in a private practice, you can work also for a multi-specialty group, or even alongside the hospital.
Yeah.
The scope of practice for podiatry will really vary from country to country, but also even here in the US, states from states will really differ.
Exactly. There's some states that they can treat only the foot. There's some states that can include the ankle. In New Jersey, we can work all the way to underneath the knee. There's some states that can even do some surgeries on the hand. And then what I like about the profession also is that you're like the expert of the lower extremity. So like a dermatologist deals with skin all over, but only skin. And then the orthopedist is going to deal with bones and joints and musculoskeletal things, rheumatologists with the joints. But then podiatry, we're kind of like the expert of the lower extremity because we deal with all of those things. We see people with diabetes, they can have ulcers, so we can do wound care. We see people with warts, so that's the skin. We see people that have neuropathy from the diabetes or also sometimes from like back disease or anything like that.
Yeah, we also see athletes, so we can treat sports injury. There's also trauma, the ankle fractures, metatarsal fractures, so and it's wide range.
Exactly, and it's nice because like a day in the clinic or like in the office is never boring. It's never routine.
Never the same.
Yeah, exactly. Like the first patient can be like, a patient that you just did an amputation because, the patient was diabetic, had an ulcer with a bone infection. The next patient after, you're casting for them for orthotics. The next one, you're taking x-rays, it's a new patient, and then they have Achilles tendonitis. So this is really nice. And now you can do ingrown nails, warts, all those things. So it's never routine. So it's really, really gratifying profession for sure.
I agree.
On this channel, you can expect to hear about foot and ankle health, educational things, reviews.
Yes. Yeah. We're going to talk about products that we trust. Yeah. We're also going to talk about what you want to hear. Yeah. So do you want to hear about ingrown toenails, fungal toenails, trauma, how to deal with sports injury, how to deal with fractures? Yeah. We're here for you.
And we want to serve some evidence-based medicine because this is very important for us. This is a platform that is going to be accessed to the public. We want to educate you properly.
Yeah. And we want the best for you.
So follow us. Please.
If you want expert foot and ankle advice from real surgeons,
make sure that you follow us, subscribe to the channel so then you will be notified next time that we release the next video. And then we'll see you next time.
See you.
Thank you for watching.